Well, we started over a year ago. It's been just past our 1 year mark in working with active duty.
Jan's a distributor of mine in Agel and loves the products and owns a massage therapy clinic here in San Antonio.
We're a group of massage therapists with a lot of expertise more toward the clinical side.
She gave me a call, and I guess for about 6 months or so prior to that, she had been working with the Intrepid, which is kind of the Brick Army Medical Center, the burn care unit there, where there's about 700 military burn victims, if you will, from all over the world.
I was injured in Afghanistan, August 19, 2006. It was IED. I think it was a couple of landmines stacked up, anti-tank mines hit the gas tanks, threw me like 50 feet.
Was in Afghanistan for about 4 months before I got injured. I was blown up and I got burnt because the explosion hit my fuel tank and set me and my friends on fire.
August 21st, 2006, I was in charge of building an Iraqi police station. In about 5 months, because I was so successful, the Al-Qaeda put out a hit on me for $500,000, and I had a suicide truck bomber with 200 tanks of propane on the back, like a flatbed truck, garden truck, drive to my front gate and detonate it.
They could see me inside the cab and that fire just going all the way around me, and then all of a sudden, you know, I'm kicking the door open and trying to get out and walk around, and they said it was just really amazing, you know, for me to even be alive.
Our vehicle ran over a pressure plate IED with some chlorine in it, so it set the vehicle on fire, and along with myself.
We were on a routine weapons cache search. We turned left and started going over a canal bridge, and IED went off, and we got hit with about 500 pounds worth of explosives. So it ruptured the fuel tank and just, you know, incinerated us pretty much.
What we wanted to do is just volunteer to see if we could help, and send a few of the guys over here to see if, at all, any of the work we could do would help.
Very skeptical at first because, you know, you get all that, the hokey-pokey stuff with massages, you know, and I know everyone's heard about it.
Me, I never had a massage or really been to any spas before, so to me they're, you know, it seemed a little girly at first.
The first day that I was in here, they did a diagnostic, you know, of my disabilities and the things that they could help me on. When Jan started touching my neck, you know, trying to find out where it hurt, she found out the spots where, you know, it hurt, and she started working on it just right then, while they're doing their diagnostic. That night, I slept better than I have in, you know, the whole time.
And it wasn't long before we had some contact direct from the hospital saying, we're really appreciative of what you're doing, can you take more? And yes, we could, and we wanted to.
Within the first 3 weeks, I was seeing amazing results, and you know, it continues to this day. Just every day, it seems like I get a little bit better.
I mean, this massage therapy, it works, and it really improves the quality of life for these soldiers that are having a hard time getting around.
It's amazing. I mean, when I first got here, there were so many issues to deal with. Jan and Richard were the ones working on me, and I'd get here like 1 and not leave until like 5, 6 o'clock.
We do it thumb by thumb, finger joint by finger joint, by the palm of the hand, a finger or two at a time, a jaw at a time, a lip at a time, a shoulder at a time, an elbow at a time, a knee, a hip, a leg, a foot. So it's really rewarding work.
I mean, these are guys that are 25 to 97% of their bodies are 3rd, 4th, and 5th degree burns. I mean, it's just amazing that they can even endure that kind of pain.
Burns are some of the most devastating types of injuries. Going forward every step of the way is excruciating.
Initially, you know, when I heard about what Jan was doing, I was like, man, I want to be a part of that. Whatever I can do to volunteer or give time or whatever, I want to be a part of that.
I've advised every single guy, because every single guy has joint damage, joint injury, to take at least 2 flex, 2 exos, and the Pro.
I think it's Flex, the one that's for joint pain. I mean, that's really starting to help out.
And I couldn't make a fist over here. The most I could get was about that, on a daily basis, even with therapy. And once I started taking the Flex, I've noticed that I can get down to where it's almost a full fist now. These products are working.
They all do what they're supposed to do, and I've got nothing bad to say except for the taste of Flex. But the benefits they outweigh the negative. So,
I mean, think about you're talking 35 individuals right now that Agel has donated already over 500 boxes of product.
Agel is very interested in supporting, their wellness and getting better. And we've already had comments on how good the Flex is, and that they're starting to notice a difference.
I mean, they're not looking for sympathy. They're not looking for handouts. They're not looking for anything like that. They're just looking for recovery.
And they all are very much appreciative of Agel doing this. I mean, they just think it's wonderful.
My heart goes out to them. I understand, what they've gone through, and it's just an inspiration to be a part of it, to be around them. So.
It's been very impressive to them that Agel has quickly responded, quickly come down, and given their unconditional support to support these guys, and they really appreciate it. They really do.